The Helping Up mission provides hope for the poor and the homeless and the addicted. And we provide programs that meet the individual's physical, psychological, social, and spiritual needs. There are 500 men who live here on this particular campus.
A place to come where they know they're loved, they know they're going to get support, both from the staff and from fellow residents, and that they'll have opportunity to engage in comprehensive treatment of all kinds.
We're able here to provide for food, shelter, and a variety of other physical services, but the medical is outside of our realm of expertise. So this is where Towson University comes in. We have had an incredible partnership with Towson University, and it's because of the leadership of Dr. Mary Lashley.
Since 2003, Towson University has been partnering with Helping Up Mission to promote health and well-being among homeless men in recovery from addiction. We started by conducting blood pressure screening clinics and engaged the men in kind of tabletop health education and discussion. And from there, we got to assess what the needs of the community were. And it became evident early on that one of the major unmet health needs had to do with oral health.
And Towson University was able to get connected with the University of Maryland Dental School. So we were able to bring over hundreds of thousands of dollars of dental care to the men here at the program, which is huge.
To get the smile restored, you have to be in the program for a little while. They realize that if they stay a little longer, they can get a beautiful new smile, and it motivates them to stay one more day. The longer they stay, they get immersed in this culture of recovery.
And bringing these organizations together in a way that is meaningful, we're able to impact the health and well-being of the men in the program.
I have about 12 undergraduate nursing students every semester. This partnership provides an experiential learning opportunity that fosters diversity awareness. It promotes interprofessional collaboration, but even more importantly, it inspires them to consider working with underserved populations in the future. And this impacts not only our students, but also it impacts Greater Baltimore.
Working in a healthcare setting doesn't really show us what the community is like. So being around these men and being around the Baltimore City community will really help us out in the healthcare setting as future nurses.
And there's a lot of different areas to become involved with community health nursing, such as here at the Helping Up mission. So I think that maybe one day I would love to come back here and volunteer, or even work here as a nurse.
Self-esteem and shame play a big part in people who struggle with addiction. And for guys to talk with people who treat them like they don't have some scarlet letter hanging around their neck, and just, talk to them like normal people with dignity and respect is very meaningful to them.
If I wouldn't have came here, I would have been lost. I would have been seriously lost.